the web training in just a few minutes, probably about 1 minute. We are waiting for a couple of people to sign on, and we'll be starting in a few minutes, in 1 minute. Recording? Yeah. Okay. Hello and welcome to our web-based training. Today we will be discussing the contributing factors placing Hispanic women at a higher risk of HIV/AIDS. My name is Esther Tellechea. I am the Executive Director of the Hispanic AIDS Awareness Program. Hispanic AIDS is funded by the Florida Department of Health, Bureau of HIV/AIDS, and our collaborators today in this effort are Miami AIDS Project and Victim Response Inc., the Lodge. A few housekeeping items. I am sure that I hope that you're seeing our first page. We have all our logos, and all it says is health disparity and the Hispanic community focus on women. Please take a moment to complete the poll, which consists of 3 short background questions, which will help us to get to know each other much better. We will share the results at the end of the training. After each segment, there will be a short Q&A questions and answer period. We encourage you to raise your hand that you will find in your screen, or use the chat box to submit your questions or any questions or concerns that you might have. We also encourage you to provide us with the feedback using the chat box. These trainings will be available in its entirety on our website after it finishes. Let me give you a little bit of an overview on Hispanic AIDS. And we invite you to visit HispanicAIDS.org, become our fan in Facebook, follow us in Twitter, and connect with us in LinkedIn. We really would like to have all of you as part of our greater group of friends and followers. Let's communicate to each other as much and as easily as possible. We are proud to have developed and produced 2 major HIV prevention campaigns, 25 Myths, 25 Realities, featuring 27 Hispanic celebrities, and the Emmy-nominated The Turning Point, with Paulina Rubio as spokesperson. You can access this campaign as well as other multimedia materials which are at your disposal in our webpage. As you probably know, Hispanic women come in all colors, shapes, sizes, and from all walks of life. Most of us speak Spanish, but do not necessarily understand each other. That means that to reach Latinas, we must take all of these factors into consideration. Today, we're pleased to have Edme Pernia, Executive Director of the Miami AIDS Project, presenting the social, economic, and cultural factors that affect the Hispanic women. Miami AIDS Project provides HIV/AIDS and substance abuse capacity building, community-based research, program evaluation, and grant development services to organizations in South Florida. Edme has extensive experience in HIV/AIDS and substance abuse, both at the community level and academia. Angela Diaz-Vidaillet will address the domestic violence and substance abuse issues. Angela is the CEO of Victim Response Inc., which operates The Lodge, a certified domestic violence shelter in Miami-Dade County. With over 20 years of experience, she's also a licensed mental health counselor. As an old friend of Angela, I am very familiar with The Lodge and the services it provides to battered women and their children in our community. I'm also proud to say that I serve on her board. And now I will turn this to Edme. Edme?
Thank you, Esther. Well, I'm going to talk about social, economic, and cultural issues, but before we get into it, I want to talk about some key facts about Latinas and HIV. In Florida, HIV is the third leading cause of death among Latinas ages 25 to 44. In the U.S., Latinas account for 18% of new AIDS diagnoses among women. Black women account for 64%, and white women account for 15%. Also, the AIDS diagnosis rate per 100,000 population among Latinas is 5 times higher than the diagnosis rate for white women. Also, Latinos tend to get tested for HIV late in their illness compared to blacks and whites. Among those who are HIV positive, the CDC data indicates that nearly 4 in 10 Latinos were tested for HIV late in their illness. It is also important to note that the mode of transmission among Latinas is largely heterosexual contact, followed by injection drug use. Latinos are more susceptible than men to contract HIV during unprotected heterosexual intercourse, and we're focusing on it. There's different reasons. There are biological characteristics. There are biological characteristics that make women more susceptible. Their partner's status, if they've had an STD, the type of exposure to the virus, the role of contraception in their lives, substance use and domestic violence, which will also be addressed in the webinar, and social-cultural factors, on which I'll focus. Now we're going to start with a short case study that depicts some of those social-cultural norms and values that can play out in prevention and treatment among Latinas. Laura, it's a 19-year-old Latina who's visiting a community health center for a gynecological exam, and she has been having sex with her boyfriend for almost 2 years. She hasn't used condoms consistently, and she's afraid that she may have contracted an STI. And Laura's mother has insisted on being present during the visit. Laura told her mom that the reason for the medical visit is to discuss a premenstrual syndrome that she has been experiencing. So the doctor asked Laura if she's okay with her mother staying during the exam. As her mother replies, "Well, I'm her mother, and there's nothing about her that I cannot be aware of." The doctor asked Laura about her sexual behaviors and health, and it becomes clear that Laura doesn't feel comfortable answering the questions in her mother's presence. He asked her, "Have you ever had sex without using condoms?" And Laura looks at her mother and replies, "Well, I've never had sex." So she badly wants to tell the doctor that she's afraid of the possibility of having an STI, including HIV, but she's mortified to admit in front of her mother that she has been having sex with her boyfriend. So she misses the opportunity to request an HIV test or other tests for STIs to be performed. Now, although one's race or ethnicity does not result in an increased risk for contracting HIV, there are underlying social and economic issues that can specifically affect a particular ethnic group, increasing the risk for contracting HIV. So we're going to discuss the cultural and socioeconomic factors that may increase the risk of Latinas to become HIV positive. But it's very important to be aware that you cannot assume that because a woman has a Latino background, all of the issues that we're going to talk about apply to all of them. Each of us, each individual has her own experience and characteristics. But we should be aware of the following issues to improve the effectiveness of their health care encounters and prevention efforts among Latinas. So even among Latinas with high levels of English proficiency, Spanish is the preferred language at home when they're in social gatherings and when they're seeking health care. apart from the knowledge that Latinas may have about HIV and the healthcare system, well, they may not feel comfortable talking about their sexual behaviors to healthcare staff, much less if the provider does not speak their language. This results in lack of trust or confianza in healthcare providers, preventing them from seeking care. In fact, there's a study that showed that 44% of Latino adults have difficulty communicating with their doctors because of language. And some persons may use a family member to interpret, but this means that they're losing confidentiality and they may not talk about the same topics with their doctors. It's also important to note that many women, as Esther said, who have identified themselves as Latinas may not even speak Spanish at all. Some of them may speak an indigenous language, or they may even only speak English. It depends with their level of acculturation and also with their age. And speaking Spanish, although it is a plus, you have to have in mind that Latinas from different countries, and even from the same country, but from different regions, use language differently. Words that mean something in one country could be offensive in another. Now, stigma and homophobia are latent in the Latino community. Latinas feel embarrassed to talk about sexual behaviors, and their partners are more likely will not discuss their sexual practices, even if they have been married for many years. So open discussions about sex, condom use in front of family members is just not comfortable. Also, HIV is associated with homosexuality, promiscuity, drug use, and some Latinos may avoid seeking testing, counseling, or treatment if infected out of fear of discrimination. The stigma around homosexuality adds to prevention challenges. And as you can see in the quote, a study among Mexicans showed that more than half of the respondents would not live with someone who is HIV positive or who is homosexual. Gender constructs like traditional gender roles and cultural norms or beliefs such as machismo and marianismo also influence Latinas' risk for HIV. For example, the traditional male gender role of machismo prevents the male partner of a Latina to seek testing or use a condom, and for Latinas to avoid condom negotiation in fear of confrontation that may even lead to domestic violence, as we'll later see. Condoms are associated with sex work illness, lack of trust, or unfaithfulness. Marianismo, on the other hand, relates to the avoidance of discussing sex and sexuality, and also power balance in their relationships. Latinos rely on the family network for support. Family among Latinos is of extreme importance, and their involvement in all aspects of life, including their health care, is almost a given. The opinion of the family may be even more important than that of a practitioner. Fatalismo is the belief that events are meant to happen due to fate, luck, or God's will. An illness may be caused as punishment for one's actions or for the action of a family member, like a divine punishment, or in Spanish, castigo divino. And this leads me to interreligion. The majority of Latinos identify themselves as Catholics, and Catholicism emphasizes compassion for the ill, rejects discrimination, but the traditional Catholic family is father, mother, and children. Being faithful and abstinence outside the marriage prevents people from discussing topics that may be against these values. In addition, no artificial methods should be used for family planning. This means that condom in the marriage should not be used. Instead, other natural methods should be adopted. So HIV prevention efforts in the Catholic Church are values-based and focus on education. Acculturation is another factor, and it has both positive and negative effects on HIV prevention for Latinas. The greater acculturation into the U.S. culture could be positive, as women may be more comfortable communicating with their partners about practicing safer sex, or also negative, as Latinas tend to engage in high-risk behaviors as they become more acculturated. Now, if we talk about socioeconomic factors, we look at poverty. Poverty has a toll on the ability of Latinas to access care. Unemployment rates among Latinas in general are high, and Latinas resort to non-traditional jobs that pay low or have no benefits. So many Latinas depend on their husbands as principal breadwinners. Poverty hinders their ability to be insured, receive regular health care, and afford medications. So it is cheaper to resort at points to traditional or folk medicine like botanicas or grandmother passed down remedies. But the lack of health insurance is actually the most significant barrier to preventive care for the Latino population. Latinos are the largest group of uninsured and underinsured in the U.S. In fact, at time of HIV diagnosis, Latinos are more likely to be covered by Medicaid than white women, and Latinos are the most likely to be uninsured of any group. So Latinos are more vulnerable than the general population to health crisis, and they seek care when they're faced with an emergency, usually at the emergency room. Latinos also have other needs that must be met before their own health. Childcare takes first place. Picking up or waiting for school kids, the household responsibilities, and also the fear of losing their job if they miss a day to go to the doctor. Transportation plays an important role in accessing care as well. The cost of gas or public transportation systems, walking in the sun, under the sun, or when it's raining, high temperatures outside, or if they have to walk with their kids to the doctor. Immigration is always latent, it's present. Immigration, the fear of deportation if they go to a doctor, if they may be reported to the authorities. Also, some women resort to engaging in sexual relationships in exchange for food, shelter, money, drugs, or even to legalize their immigration status. These are survival strategies. And we can't leave apart migrant seasonal farm workers who face additional issues due to the transient nature of their work and that of their partners. There's geographic limitations and also lower literacy levels. So once Latinos have learned they're HIV positive or consider themselves at risk for HIV, some factors may prevent them from seeking care. So as we mentioned before, ahead. Let's see. As we mentioned before, there. HIV-related stigma may prevent Latinos from seeking care. The fear of rejection and losing the support of their social network can also lead them to depression. There's high numbers of depression among HIV-positive women. Financial dependency and power relationships between men and women could also hinder disclosure of health problems, seeking of appropriate health care and condom negotiation, including domestic violence and sexual abuse. So Latinos are caregivers, and they put their well-being of their family first, and their own well-being is always last. And this causes some Latinos to focus on HIV only when the infection has directly affected their family. Now finally, women don't consider themselves as at risk for HIV. You know, why should I worry? If I have one partner, I have a husband or boyfriend, they're straight, I'm straight, my partner is straight, and they don't use drugs. So women have a perceived invulnerability to HIV. They may not be aware that their spouse has multiple sex partners, or that they're in the down low, or what's called, it's also known in Spanish as bugarrones, men who have sex with men but do not identify themselves as MSM or bisexual. So Latinas may not even consider asking their male partners of their sexual practices, even if they suspect they are engaging in sex with other men. Now, this may not be necessarily the same if they believe they're having sex with another woman. In addition, some studies have suggested that even health providers are less likely to recommend HIV testing to married Latinas. So I want to make clear that although cultural norms and values may present challenges in the prevention of sexually transmitted diseases, they should not be taken as negatives. Culture is not negative. Instead, they should be embraced to improve prevention messages that can appropriately engage Latinas in HIV testing and to take control of their health. And the socioeconomic issues that we saw should also be addressed at the policy level to reduce the risk of Latinas for contracting HIV. Now, this is a good time. This concludes our section on socioeconomic and cultural issues. And right now, I'll be happy to address a couple of questions or comments you may have. Olga?
If you have any questions, please feel free to use the chat button on the bottom or raise your hand and we will get to your question. We have a question here from Fatima, from Zoe. We'll unmute the lines now.
Phil?
Okay, unfortunately, we're having an issue with unmuting our line. Jason Warner has a question. Jason, if you could use the chat and we would get to you that way.
Okay, while we work out the little glitch on the hand and the questions part, let's go on to Angela's presentation. So Angela, please go ahead. Hello.
I'll be talking about domestic violence, and I wanted to start with a brief definition. Some of you, if not all of you, are probably familiar with the topic, but I think to lay the groundwork would be very good. So when we talk about domestic violence, we talk about a pattern of controlling and coercive behavior, which is inflicted from one partner to another. And the purpose of that behavior is to control the other individual, their actions, their thoughts, their behavior. Intimate partner violence or domestic violence includes such things as physical assault, sexual violence, threats of physical or sexual violence, psychological and emotional abuse, stalking, economic abuse, using the children. Usually, and we will talk about it down the line, usually the physical part of the violence and the sexual part does not happen all the time. It just serves to tie everything else together. Nearly 1 in 4 women in the United States is a victim of domestic violence in her lifetime. Every 15 seconds, a woman is beaten in the United States. Domestic violence results in more injuries that require medical attention than rape, accidents, and muggings combined. In Miami-Dade County alone, last year, we saw 40 cases, domestic violence, homicide, suicides. So the homicide-suicide cases obviously is where he kills the woman, maybe her children, and then ends up killing himself. In actuality, 30 of those 40 were women who were killed, deaths of women by the partner. So 10 of the abusers killed themselves. We have multiple homicides all the time. One of the ones here in Miami last year, there were also, I believe, 3 to 5 other people killed who happened to be in a public place where the woman was a target. So the cycle of violence is something that when our movement started, we were talking a lot about the cycle of violence and how we thought, right, until we really started asking all women, we thought that it's something where there's a tension building phase, then there is the abuse or the battering that takes place, and then he apologizes and brings her flowers. As a matter of fact, there's a poster, I don't know how many of you have seen it, of a woman who's dead, and the poster says, he only brought her flowers once. So we were under this, it's almost magical thinking that there is a honeymoon period. However, in talking to women, we have realized that in a lot of the times there isn't. So for those of us in the field, we prefer to talk about a campaign of violence, not a cycle of violence. A cycle of violence suggests that the violence occurs in a regular pattern and that there is always an outburst of violence, while a campaign of violence is based on those other behaviors that I just told you about. They're non-physical, non-sexual tactics that batterers choose in order to control their spouse. A campaign of violence also suggests that the physical and sexual violence has to happen only once. Only once. It doesn't have to be ongoing. Abusive tactics help achieve the batterer's goal of control. So if the violence happens only once, he keeps her in her place, right, for the way he understands it, with looks, with intimidation, with breaking objects in the house, with kicking the pet. So there are many ways in which once the violence has occurred, he reminds her that it could occur again. The cycle of violence suggests that there's a tension-building phase and that then physical violence happens. But it is not. It doesn't have to be that way. So that's why for us in the field, we prefer to use the campaign of violence as it brings home really the experience, the daily experience of battered women. When a lot of us see them, we may see them after an incident of violence. But she is walking around every day with a threat, with a sandbag over her head, that if she doesn't do things right, what happened once may happen again, and it may be more severe. So I know that this is a new way of thinking about it, but it really does bring home what battered women go through. So when we talk about Latinas and domestic violence, we're really, it's a little bit more complicated now, right? Because we're now bringing in issues of culture. Not necessarily a culture that accepts battering as a way of life, but traditions that may impede battered women's safety, but as it was mentioned before, traditions that later on can also be used to keep her safe. So because of a strong sense of culture, she may feel that she is betraying him by disclosing the violence. For Latinas in general, and we know that this is not for everyone, family obligations always come first. That's the first thing ever. You know, I used to know an anthropologist, a Cuban anthropologist, that would talk about how all of us have someone in our family who is mentally ill. And that's okay, even if they're violent, until the violence turns towards the family. Then it's not okay anymore. Then we mobilize. So family obligations, we will go to the end of the world for a family member. A Latina who cannot keep her family together is considered a failure. And this is a message that she gets not only from society, but from religion, from our religious organizations. And as it was mentioned before, also Catholicism is one of the main religions in the Latino community. We also see, and this is really interesting, right? We see our relationship as this is our cross to bear. I mean, how more ingrained in Catholicism can that be? This is our cross to bear, for better, for worse, till death do us part. And a lot of times, that's exactly the way it is. There's always the threat of immigration as one of the tactics of control that men use to keep the women silent. You know, and here for us in Florida, this is something that we see too often. Recent studies have shown that male-to-female domestic violence is associated with numerous risk factors for HIV. And, you know, I don't know about you guys, but when Tellechea started talking to me about this, I thought, well, what does that have to do with domestic violence? Well, you know what? It has a lot to do with domestic violence. Domestic violence victims are forced to have sex. They're raped. And we don't associate rape and sexual assault with victims of domestic violence. Because, again, we just think of a woman being bruised, right? Her face, her arms. But we don't think of those other forms of violence. And he does this as a way to gain control and to maintain control. A lot of times sexual assault is used to degrade her. So it's just, we're not talking about having sex. We're having about using sex as a tactic of control to humiliate her. She has no control of her reproductive life. Some abusers will purposefully infect her with the virus in order to prevent her from leaving. Years ago, when I started working in this field, my work was with men who batter. And I recall having one specific guy in one of my groups who disclosed his HIV status to me. And when I probed as far as his partners, this man, since being HIV positive, had been with 3 different women, and he had not told. And he did not think that he had a duty, a moral duty, to tell them because they were bitches anyway. So this is his thinking. So it's okay to expose her to the virus and to maybe cause her death because anyway, women are disposable. He may be involved in another sexual relationship, not only with other women, but with men. Like we heard before, this is one of our cultural issues in our community where men have sex with other men and they don't consider themselves to be gay. So he's engaging in high-risk sexual behavior. She has no idea that this is happening, and he is bringing it home. They also prevent women from seeking medical attention. So if she was infected, she may not realize what is happening with her until it is too late. It is all about controlling her behavior and using any means possible to do so. So the women who reported victimization by an intimate partner were more likely to report sexually transmitted infections, inconsistent condom use, forced sex without a condom. And you know, it's really interesting when Edme was presenting before, the women that are at highest risk of being infected with HIV, there is a group of those women who are also the women that are at highest risk of experiencing domestic violence. Women between the ages of 18 and 24 years old are the women that are at the highest risk of experiencing domestic violence. So addressing and assessing domestic violence or intimate partner violence could really be a way for you to start learning about some of these other issues that are going on as far as HIV. So you can see the rest of the list of what we get from these women when they talk to us about domestic violence and HIV and their partners' relationships with others. So women are at a risk a lot of times, not directly because of their behavior. Most time it's not because of their behavior, but because of the abuser's behavior. There is a 0 to a very rare chance of condom negotiation. Okay, number one is we just heard about the issue of religion. So she will be going against the religion. There will be a fear of being victimized by the abuser. Number one, he may think that she's accusing him of being unfaithful, and that may not be the worst of the scenarios. The worst of the scenarios may be that he thinks she is being unfaithful. So she is totally powerless to convince him to use a condom. And you know, issues of unfaithfulness is a lot of times a precursor for battering. Jealousy, we know about all the issues of control relating to jealousy. But for now, if you guys have any questions about the domestic violence part of the presentation?
I have actually some great questions here in the question and answer box, and we're going to get to them. We have a question about this PowerPoint being available after the webinar. Yes, it will be available on our website after the webinar. We also have a question says, why are health providers less likely to ask married Latino women if they would like to be tested? Edme, would you like to answer this question?
Sure. Could you repeat it?
Yes. Why are health providers less likely to ask married Latino women if they would like to be tested?
Well, I don't know the exact reason, but one of the reasons, as we talked about, they're married. They have one partner. And when you go to a health provider, the first time you go, they do an assessment and they ask you different questions, risk assessment questions. If you've had multiple partners, if you use drugs or alcohol. And then after that first assessment, the question may not be raised again. So a married woman would only get an HIV test when they get pregnant. And that is an issue of concern. Plus, as I was discussing at another training, there's no time. Providers don't have enough time during their visits to talk about in depth about these issues. They have about 8 minutes with each patient, so that's also quality of healthcare.
We have another question here, and this one is probably best for Angela. Angela, how do you best ask a victim or one of the ladies that end up at the shelter to agree to get tested? Or do you ever ask to get tested?
I mean, we don't ask them. We educate them. As a matter of fact, you know that Hispanic AIDS is one of the organizations that has been here before offering the service. We are looking now at becoming a rapid testing facility to have that as an option. Again, because for me, and I imagine that for a lot of us in domestic violence, disconnect. Where I was so focused on the violence that occurred that I wasn't thinking that this could be an important part of a woman's health history, because we do talk to her about health issues, but never thought of HIV/AIDS. It is now one of the things that we bring up and we give her choices. As a shelter, we cannot force her to get tested, and it's really it's an ongoing issue, even for those women who do come into shelter and are HIV positive, in working with the staff, and they choose to disclose it to the other center participants.
Okay, there's a question here in general. It says, are pregnant women tested automatically? Do you have do you want to address that one?
I'll take that. Well, they ask you the question. You can refuse an HIV test if you want to. Although the CDC recommendations is that everyone get tested, and they give you the option to opt out of an HIV test.
There's a question here that says, violence and contraception STI negotiation that your agencies implement, how effective are these programs? Everything you said is true about, I'm reading, about Hispanic or Latino population. You also stated that young people are at high risk. Also speak about what is being done with this behavior, and now that the Hispanic group is part of a large open culture group as part of this status in this country.
Well, yeah, that's really interesting. I mean, you know, later on, I wanted to mention, and I'll mention it now, you know, what's interesting is that when women, Latino women acculturate, more likely alcohol. So the part that we are now doesn't necessarily bring with it safety, because we as a community may not have the coping skills to join that big population. So a lot of work needs to be done, and the work is not necessarily to assist in acculturation as it is to arm Latinos with the tools to be able to face this whole new world, because it is a very, very new world to us. It brings freedoms that we were not born into and we were not raised into. So it really, the work that needs to be done is a work of teaching and prevention and how to deal with the new freedoms that we have found.
Excellent. I totally agree. We have to go back to Angela, to the regular presentation. The questions were wonderful, but time is of the essence. Angela?
Yeah. Here, I'm still here. So a smaller piece now for me on substance abuse, domestic violence, and HIV/AIDS. You know, and it's really interesting because substance abuse, there's a myth in domestic violence that that people need to be, that abusers are either crazy or alcoholics or drug addicts. No, you know, substance abuse, and as we know, substance abuse does not cause HIV infection. However, the mixture of an HIV-infected abuser who is either drug dependent or alcohol dependent, combination. Okay, so, you know, we just talked about an age group. Picture that one. Picture that 18 to 24-year-old Latina, disco, her boyfriend who may be HIV positive, going home, getting beaten, raped, have looked at someone else. And imagine how often that may be occurring and we don't know anything about. So an incredible combination. Substance abuse via direct contact with contaminated needles, and an individual's likelihood of engaging in high-risk sexual behavior such as unprotected sex. I mean, we know that what the use of drugs or alcohol does is really, it lowers the inhibitions of individuals, so it gives them the permission. It gives them the permission to be violent. It gives them the permission to act out sexually. So it's really, it opens a whole new range of behaviors that may have, the thought may have been there, but the person did not have, if we want to call it so, the courage to act that way. Studies suggest that drug abuse and dependence was higher for Hispanics, 9.8%, than among whites, 8.3%. And then keep in mind what I told you before about us not having the tools to deal with it, you know? So now the Latinos are, I mean, I would love to see the statistics on DUI, for example, in the state of Florida. I've had men in batters groups with DUIs, and they never had a license. So not only were they driving without a license, they have multiple DUIs because they did not understand this. This is what they did all the time, and nothing ever happened before in their country. Alcohol abuse among Hispanic females, 42% among Hispanics, 42.2% higher than other ethnic minorities. I just mentioned before, one of the things that happens is that as females acculturate, they're more apt. This is research that has been done where Hispanic women, Latino women, who are part of the bigger society and who have acculturated are more likely to be intoxicated during sex than those who have not been acculturated. However, again, keep in mind that it is not her substance abuse that puts her at risk for the HIV infection. It is his substance abuse, because most of the time when we're talking about her substance abuse is alcohol. He may be intravenous drug use. He may be engaged in having sex with intravenous drug users, with prostitutes, and with other men. There's a higher rate of substance abuse in the Hispanic male population as compared to Hispanic females. Hispanic women are indirectly affected by the partner's substance abuse because of their close association with intimate partner violence and HIV. So really what that means is HIV, domestic violence, and substance abuse are interwoven. Substance abusers are more apt to engage in risky sexual behavior. Women who are submitted to a campaign of violence may not have much control over their sexuality. Domestic violence perpetrators who are addicted to drugs or alcohol and are HIV positive are a lethal combination. So a woman's partner's risk behavior must be considered when evaluating her HIV risk. If you take anything away today, is that if you're working, if the Latina comes to you either as a survivor of domestic violence or as someone who is HIV positive or someone who has a alcohol or drug dependence, not only take a look at her, look at her partners, because whatever she's presenting to you may really be a lot deeper, and unless we assess her partner and what he's doing and where he's at, and we have to do that basically through her eyes. That's all we can do, but at least it will assist us in providing or offering the appropriate services. That's it for my presentation. So if there are any further questions, I leave it to
Angela. We'll go back to some of the questions. And I'm sorry for a little bit of the noise on the line.
We muted all the lines because there was some interference with someone else who hadn't muted their lines.
There's a question here specific of how can someone be certified in order to become an HIV presenter or speaker within the community or specifically the schools? You're going to have to reach out probably to your individual health department, county health department, or the health department in your area, and they can probably direct you in the right direction. If not, send us an email. Anybody who has additional questions, send us an email, and we'll be happy to do the research for you. There's also a question here of how we can approach what type of, maybe Angela or Edme, I don't know because I don't have the answer. How can we instill in the doctors the need to talk to the ladies and to take into consideration all that we have spoken, and the need to get the ladies tested for HIV regardless of their marital status?
Right. Well, it is also one of our concerns. There's a lot of need for increasing the cultural competence of providers, health providers, for doing this precisely. And we are first, in our agency, that's one of our goals: provide training to healthcare professionals to address this, to appropriately address these issues, having into consideration all the things that Angela talked about and all the cultural issues that are present among Latinas and in general among women. But there is a lot of concern about that, and hopefully in the national strategy, the President's HIV strategy, there's some inclusion about this issue about cultural competency and cultural capacity training for providers.
Yeah, we were just talking today even about the basic issue of physicians screening for domestic violence. So, you know, it could be something that at least here locally we can partner and start doing something. Because I know that as far as the screening for domestic violence, JACO mandates that it be done, and it is not being done. So Latinas and the population in general is going to their healthcare provider, and these things are not being looked at. Domestic violence, substance abuse, and HIV. So it may be something that we could consider doing together to try to make an impact in the community.
I also know that as a practice, and I know I have Yvette as one of our attendees, and thank you for being with us, Yvette. She works with pregnant women of all, not necessarily Latinas, and they're trying to get them tested at least twice in order to prevent the transmission to babies. So any of you who are working with the Hispanic community or any other community that happens to be helping somebody who is pregnant, please encourage them to get tested as early as possible once they know they're pregnant, and then 3 months after, because that is about the only real success we have had on HIV/AIDS is the transmission to babies can be eliminated. Let me find another question. And please, this is a reminder, please take the poll. There's 3 individual questions.
The poll up that we had here that you're seeing the results for on your screen, we see that 74% of you actually work with all populations within the community. So if you have any questions whatsoever regarding your Hispanic population, you can feel free to email us. We'll have our contact information at the bottom. We're going to launch a second poll here. We would love to hear your responses. Let's see here. Well, Tellechea works on this, works on the questions here.
Okay, basically, I guess we're having a little bit of polling problems here. I don't know. Basically, let me just say that please, anybody who we had not been able to answer the question because of time constraint or anything else, maybe we missed it and I apologize, please send us an email and we will get an expert to respond to you. We are also asking you to send us any comments that you might have on the presentation as a whole, and we'll be happy to get that feedback. You will find the presenter's contact and our own, and again, Angela and Edme has agreed, and myself, that they will be answering any questions that you might want to send to them directly. We're here to help you, and all our resources are your resources. We have another. We have listed all the references used in this presentation for those of you who want to go ahead and research a particular topic a little bit more in depth. Remember that all the information will be available on our website within a week, and you can review this transmission, and you can review the resources, and you have all of us as your contact. I want to thank you, our presenters. Edme, please, thank you, and welcome Miami AIDS Project to our area. I want to thank you, Angela. Thank you for being our friend and always being there. And on behalf of the Hispanic AIDS Awareness Program, we look forward to seeing you in our next web-based training, and we will be sending you the information as soon as we got the date set up. Once again, thank you and goodbye.